And let's start a few SBAs which are related to the our chapter genetics. So starting with the question number one, the pre-implantation genetic diagnosis is it is usually required the intracytoplasmic sperm injection, which is also known as the ICSI. So what are the problems with the PCR? The PCR problems containing by the DNA from the environment, laboratory staff, and other cells, including the sperms and the cumulus cells. For these reasons, ICSI intracytoplasmic sperm injection is used prior to the pre-implantation genetic disorders. Second is the allele dropout. This is the preferential amplification of one allele only and is particularly important in the autosomal dominant condition. If the mutated allele they drop out, the embryo they would be erroneously diagnosed as the normal. Then pre-implantation genetic diagnosis is not associated with an increased risk of the miscarriage and the congenital anomalies. Now let's move towards the chapter question number two. If both parents they have the beta thalassemia minor, the chances of the male offspring having the beta thalassemia major is 25%. We have discussed that the in this case it is the 1:4, 1:4, so that it is the 25%. Basically the beta thalassemia, it is not an excellent condition, so the sex of the child they makes no difference to the inheritance, and the child will have in the 1 in 4 chances of having the beta thalassemia major. Let's discuss some key points regarding the beta thalassemia. The RCG they produced a green top guidelines number 66 in the March 2014, the management of the beta thalassemia in the pregnancy. 1 in 100,000 global incidences, and 70,000 babies they born with the beta thalassemia each year, and the causes caused by the mutation in the HBB gene at the chromosome number 11, autosomal recessive inheritance, and the homozygous beta thalassemia major produces severe transfusion dependent anemia, and the heterozygote beta thalassemia the minor trait and the carrier they produce a mild microcytic anemia. And few more things regard in the pregnancy. They need the extra scanning in the pregnancy. Women they should be offered an early scan at the 7 to 9 weeks of the gestation, in addition to the routine first trimester scan 11 to 14 week of the gestation, and detailed anomaly scan at the 18 to 20 plus 6 weeks of the gestation. The women they should be offered the serial fetal biometry scans every 4 weeks for the from 24 weeks of the gestation. The thromboprophylaxis, women with the thalassemia who have undergone the splenectomy and have the platelet count of more than 600, they should offer the low molecular weight heparin and the aspirin 75 mg per day. And the women with the thalassemia who have undergone the splenectomy or have a platelet count more than 600, they should be commenced on the aspirin 75 mg per day. And women with the thalassemia who are not already using the prophylactic low molecular weight heparin, they should be advised to use it during the antenatal hospital admission. And a few more points. Cell division is arrested in the metaphase. Sorry, this is related to this question. So our next question number 3, it is for karyotyping to be taken from the peripheral blood, it should be cell division, and is there the multiple options which are given in the options. So the correct option include in these options were the cell division is arrested in the metaphase using the Golgi. So here I will also share this PDF on our Telegram channel. You can visit there and get this PDF for free. The cell division, it is arrested in the metaphase by the addition of the colkin, which prevents the spindle formation, and the chromosomes they are typically stained with the GIMSA G bending. The bending, the pattern of each chromosome is characterized with the dark band containing mainly inactive genes, and the other bending pattern they can be obtained using the quinacridine. The Q bending visualized by the ultraviolet light. C bending to be shown highly representative microsatellite repeat DNA at the centromeres, and the bending they allows the identification of missing or additional chromosome material of at least 4000 kb. Now okay, this table is also related to the thalassemia part. And let's see the initial management of the pregnancy. Diabetes, they should be screened for and well controlled. If detected, refer the diabetologist. Thyroid function, they should be screened, and the patient they maintain as the euthyroid. The patient they should be assessed by the cardiologist and have the ECG, echo, and T2 cardiac MRI. All patients they should have biliary ultrasonography and have the Faris scan or the liver T2. All women they should be offered bone density scan and the folic acid 5 mg daily. They should be commenced 3 months prior to the conception in these patients. All women they with the thalassemia major they should be receiving the blood transfusions on a regular basis, aiming for the pre-transfusion hemoglobin level of the 100 gram per liter. Now moving towards the next question. Which of the following statement they best describe the action of the reverse transcriptase? The action of the reverse transcriptase. And it is enzyme producing cDNA. Enzyme producing cDNA. The reverse transcriptase enzyme produces a complementary DNA cDNA, and the retrovirus family is characterized by the reverse transcriptions of the viral RNA genome to the cDNA, and the interactions into the host cell genome, which is mandatory mediated by the viral integrase enzymes. Now the next questions, which one is not an autosomal recessive conditions? We have discussed this previously mnemonic in our last video, and here's the option given option. The Huntington disease was the correct answer. Examples of other autosomal recessive conditions includes the cystic fibrosis. Basically we have discussed that they are the mostly the metabolic disorders, including the cystic fibrosis, sickle cell disease, the phenylketonuria, the adrenogenital syndromes, and the mucopolysaccharidiosis, and the spinal muscle atrophy. Now the next questions. A 41-year-old man undergoing an elective inguinal hernia repair develops a marked pyrexia. Intraoperatively malignant hyperthermia is the recognized complication with the use of the which drug? It is a very common question and most important MCQ. It is a succinylcholine is the answer. The malignant hypothermia, it is a serious autosomal dominantly required condition linked with the other myotonic disorders, and the intracellular calcium transport is deranged, and the generalized muscular contractions they generated the heat and may be precipitated by the anesthetic agents. It is treated with the dantrolene, which is also another important MCQs, and the propofol is used in the management of the malignant hypothermic patients. Now moving to the next question. Which of the following statement regarding the phenylketonuria is true? In the given options, the answer was the UK incidence is 1 in 14,000. And a few key facts regarding the phenylketonuria. It is an inborn error of the amino acids metabolism, and the most common in the UK. They caused by the absence or the severely deficiency of the phenylalanine hydroxylase and enzyme, which converts the dietary phenylalanine into the tyrosines, and high concentrations of the phenylalanine they lead to the increased level of the byproduct phenylpyruvic acid and the phenylethamine, which becomes neurotoxic in the high concentrations. Untreated they can be this can result in the mental retardation. The treatment is by the dietary modification by the restrictions of the dietary phenylalanine, and the heel prick blood of the phenylalanine assay they should be done more than 12 hours after the birth. And there are the three types of the phenylketonuria: the type 1, which is autosomal recessive inheritance, the type 2, and the malignant PKD. Next question. Which fetal tissue is not typically used for the karyotyping? It is the fetal red blood cells. The karyotyping they utilizes the peripheral blood lymphocytes, and they can still perform on the samples received in the lab more than 24 hours after the sampling. They can also be performed on the chorionic villi, the fetal cells for the amniotic fluid, and the fetal blood sampling from the blood sampling. Skin and the skeletal muscles they can also be used after stillbirth. And the red blood cells they do not have a nucleus and cannot be used for the karyotyping. The next question. In which of the following malignancies are the tumor suppressor genes MLH1 and MSH2? The answer is the HNPCC, which is the hereditary non-polyposis colonic carcinoma. And MLH1 and MS2 are they found in the patients who are suffering from the hereditary non-polyposis colon cancer, and also some cases of the endometrial cancer. So the last question of today's PDF is, which organelle has its own self-replicating DNA? It is the mitochondria. It is very important MCQ. Many times it has been asked in the exams. And the mitochondria, they are both recognized to contain the DNA and give rise to the maternally inherited disease such as the mitochondrial myopathies, and including the red ragged fibers and the Didmoid syndrome and the Wolfram disease. So this is it for today. Take care and see you in the next video.